With me to discuss oral health is Roger Matthews, Chief Dental Officer at Denplan, Anusha Alavi, Colgate Scientific Affairs Manager, UK and Ireland, and the Department of Health's Chief Dental Officer, Barry Cockcroft. It's Oral Health Month, so there are certain things that we're going to be screaming at people to do.
Yes.
Tell us the
Well,
first
the first thing is to be aware that everybody has control over their destiny in terms of how they keep their mouth healthy. If every child is born with healthy teeth, as indeed they are, the way to keep them healthy is to make sure they brush their teeth twice a day, they use the right level of fluoride, which is a family strength fluoride toothpaste.
Let me just interrupt. What age is a child able to use adult toothpaste?
Well, the recommendations from the Department of Health are up to the age of 3, it should be at least 1,000 parts per million, and people can always look at the back of the pack of their toothpaste and read how much fluoride is in there. And from 3 onwards, they can go to a family strength, which is between 1,300 and 1,500 parts per million. And that's essential because the right level of fluoride in the toothpaste, not necessarily the volume of toothpaste, but the right strength of fluoride, is key at making sure their teeth stay healthy.
The fact that people get advice very early on, even before a baby is born, but as soon after it's born, about how to look after the baby's teeth. They can get advice from the dentist, they can get advice from the health visitor, or from the midwife even. You can get advice on dental health now, because we're making sure this message goes out across all the health professions, so that this message is constantly reinforced and mums and parents have the opportunity to get that advice early on, get the right level of fluoride in the toothpaste, get the right amount of fluoride toothpaste on the brush.
I mean, we keep talking about fluoride, but a smear?
A smear, just a smear
what, on your finger?
Toothpaste on the brush, just to start. As soon as the teeth come through, just a very thin smear of toothpaste on the brush, and start brushing as soon as the teeth appear. Very important that these habits are established as early as
If you
possible.
develop good habits stay with you for life.
But also, we at the beginning we were talking about diet.
Yes.
Now, a good snack for teeth. It used to be an apple a day keeps the doctor away, and then you read apples contain sugar. What is good? What is low sugar, high sugar, good snack, bad snack?
I think in terms of diet advice, and bearing in mind there are limitations to how much you can restrict children from having sweets, the key point is snacking on sugar by itself is far more detrimental than if there was a sugary element to part of your main meal. Finishing a meal with a savoury, I don't know, piece of hard cheese, for example, is a lot better than finishing it off with a sweet. So I think the French had the right idea. It's little tips
How
like
dare
this.
you say that?
Yeah. The other thing is about drinks. I mean, drinks are very significant
Yes.
in this. If you're looking at very sugary drinks, very acidy drinks, these are not very good for you at all. You know, if you drink still drinks, if you drink, just water or milk or something like that, much better than acidy drinks. I mean, a lot of people have got no dental decay but do suffer from what's called acid erosion. And actually, if you're drinking fizzy drinks all the time, that can be a real problem.
Yeah, acid erosion, is that when the tooth...
The teeth get dissolved away, they get eroded away by the acid in the drink, typically fizzy drinks that will cause acid erosion. Used in excess, I think when you mentioned the apple a day, now everybody worries about the apple a day, moderation. You know, if you're having an apple a day, that's absolutely fine. I don't have any issue with that, and I don't think any dentist would. Or an orange a day, not a problem. Yes, there is sugar in fruit, but there are lots of other things that are very good for you in fruit in terms of minerals and vitamins and fibre that you should be consuming, and they far outweigh the damage of fruit sugars. It's the sticky, processed sugar foods that are going to do the harm. And it's not just the amount, it's the number of times you eat them. With my children, yes, you can't ban them from having sweets. In fact, that's possibly the worst thing to do, because then they acquire a value, a cachet, all of their own. Johnny's got a whatever bar, and I want one too. So what you do is you say, well, you can have some sweets, but they're restricted either to meal times or to a day of the week. When I was in practice, we used to say that tooth decay ran in families, but it didn't matter whether the children were natural or adopted. And that tells you a lot.
That's it.
It's the diet that affects.
Yes.
It's the diet, the behaviours and the attitudes of the family that far outweigh any...
So when, you say things like, that it doesn't.
No, it doesn't.
And
I think there is a slight evidence that suggests it might influence it, but the causes of tooth decay, the causes of gum disease are inherently the same. There may be people, because of certain genetic circumstances, where they might be slightly more sensitive or otherwise, but the evidence to support that isn't strong. But you would, there may be faults in tooth development or something like that which would make a person more sensitive if their enamel's not formed properly, or something like that. But on the whole, just as Roger says, the causal factors remain the same. If somebody says, I never could do anything about my teeth because bad teeth run in my family, which certainly I heard as a dentist, that's not correct. That's just an excuse for not looking after yourself properly or not looking after your children properly. I think dental disease is very different from a lot of other diseases for two reasons. One is that it's almost 100% preventable by patient and prevention and professional action. In other words, if the patient has the right diet, brushes their teeth, the dentist uses the fluoride varnish, you could almost guarantee that child is going to be free of decay. I think the other very significant thing is that dental disease doesn't heal. So if you get tooth decay, you have a filling, you've got a filling for life. If you have an extraction after you're 6 or 7 and you've lost a tooth, you've lost a tooth for life. So the motivation for prevention is so strong, because not only is it something which is completely preventable, but it isn't actually, it's not treatable, it's repairable. You can repair a tooth that's spilled, but you're not actually treating it, and that patient has that filling for life.
final word to you.
This is all about how important it is for the advice for maintaining health, especially your oral health, not just to be confined to when you go and visit your dentist or dental hygienist or anybody else in the dental team. Just like every child at school is taught about 5 a day in terms of a healthy diet or regular exercise, I think this is an opportunity to just let the general public know. These are the basic key bits of advice. This is what parents should watch out for. This is what adults should look after. It's about cleaning their teeth regularly. It's about using fluoride in the toothpaste to be applied to their teeth twice a day. And beyond that, there are many preventive measures, as have been discussed, that the dental team can take on once they go and visit their dentist. And honestly, the sort of the bad memories of what happened in the dental chair, it really needs to be a thing of the past. And this is what this is all about.